Which of the following is not a primary physiologic cause of shock? A. Hypovolemia. B. Cardiogenic. C. Obstructive. D. Distributive. E. Hypoglycemia. Answer: E. Hypoglycemia. In which type of shock is there a reduction in venous return to the heart? A. Cardiogenic shock. B. Septic shock. C. Hypovolemic shock. D. Neurogenic shock. E. All of the above. Answer: E. All of the above. Which physiologic change is most characteristic of cardiogenic shock? A. Decreased systemic vascular resistance, SVR. B. Reduced cardiac output. C. Increased heart rate. D. Decreased pulmonary capillary wedge pressure, PCWP. E. Increased stroke volume. Answer: B. Reduced cardiac output. In which type of shock would you expect to see warm, flushed skin despite hypotension? A. Hypovolemic shock. B. Cardiogenic shock. C. Obstructive shock. D. Septic shock, early stage. E. Hemorrhagic shock. Answer: D. Septic shock, early stage. Which condition can lead to obstructive shock? A. Massive pulmonary embolism. B. Cardiac tamponade. C. Tension pneumothorax. D. All of the above. E. None of the above. Answer: D. All of the above. In late-stage septic shock, which hemodynamic change would you expect to see? A. Increased systemic vascular resistance, SVR. B. Decreased cardiac output. C. Cool, clammy skin. D. All of the above. E. None of the above. Answer: D. All of the above. Which physiologic change is least likely in neurogenic shock? A. Hypotension. B. Bradycardia. C. Warm, dry skin. D. Tachycardia. E. Decreased systemic vascular resistance. Answer: D. Tachycardia. A patient presents with signs of shock after a severe allergic reaction. What is the primary physiologic cause? A. Hypovolemia from fluid shift. B. Cardiogenic from myocardial depression. C. Obstructive from airway closure. D. Distributive from mast cell degranulation. E. Neurogenic from anaphylactic reaction. Answer: D. Distributive from mast cell degranulation. In a patient with cardiogenic shock, which compensatory mechanism might paradoxically worsen their condition? A. Increased sympathetic tone. B. Renin-angiotensin-aldosterone system, RAAS, activation. C. Antidiuretic hormone, ADH, release. D. All of the above. E. None of the above. Answer: D. All of the above. A trauma patient presents with shock. Initial assessment shows tachycardia and cool extremities, but normal blood pressure. What's the most likely explanation? A. They're not in shock. B. Early hypovolemic shock with compensation. C. Early septic shock. D. Tension pneumothorax. E. Neurogenic shock. Answer: B. Early hypovolemic shock with compensation.